Hello everyone. Today we are going to learn about principle of psychiatric nursing, which is called general principle of mental health nursing as well. So first we will see what is psychiatric nursing. Psychiatric nursing is a specialized area in nursing field, right? It is a medical specialty where the expert in the field of studies the abnormal behavior of the individual, its causes, manifestations, treatment and rehabilitation and prevention of mental illness. And what it deals with promotion of mental health, prevention of mental illness, care of client with mental illness, cure of mental illness and rehabilitation of mentally ill patients. Now we will see principles of mental health and psychiatric nursing. First, let's see what is general principles. So principles focused on the specialized utilization of client and treatment with respect an individual human being. And there are general principles that applies the care of all who show behavior disorder. Everyone has certain basic needs that must be met no matter what disease he or she is suffering from. The principles are general, which are applicable to mentally ill patients as well as physically ill, where his illness is usually associated with emotional disturbance to some degrees. So let's see what are the principles. General principles of mental health nursing. The principles are based on the concept that each individual has an intrinsic worth and dignity and has potentialities to grow. The following principles are general in nature and from guidelines for emotional care of the patient. So what are the principles? Let's see. First is accept the patient as he is. Second one is use self-understanding as a therapeutic tool. Third one is use consistent behavior to increase patient's emotional security, give assurance to patient. Then change patient's behavior through emotional experience and not by rational interpretation. Avoid unnecessary increase in patient's anxiety. Then demonstrate objective observation to understand and interpret the meaning of patient's behavior. Avoid physical or verbal force as much as possible. Provide nursing care to the patient as a person and not on a control of symptoms of the disease that he has. Maintain realistic nurse-patient relationship. Explain routine and procedure at patient's level of understanding, and many procedures are modified but basic principles remain unaltered. So these are the few principles which we are going to learn in details today. Let's start with first principle. Patient is accepted exactly as he is. So acceptance conveys the feeling of being loved and cared. Acceptance meaning being non-judgmental. Acceptance does not mean complete permissiveness but setting of positive behaviors to convey to him the respect as an individual human being. So when you are accepting the patient, when you are conveying the feeling of being loved and cared, then patient will also understand that yes, he or she is accepting me with all my abnormalities or whatever my behavior is towards him or her. In that, first we are going to see the being non-judgmental and non-punitive. The patient behavior is non-judged as right or wrong or bad. As we all know, we are dealing with mental health. So when patient is mentally not stable, definitely his behavior we cannot judge, right? So the patient is not punished for his undesirable behavior. All direct and indirect methods of punishment must be avoided. A nurse who shows acceptance does not reject the patient even when he behaves contrary to her expectations. Next, being sincerely interested in the patient. How we can demonstrate or how we can show that we are interested in patient. So, studying patient's behavior, allowing him to make his own choice and decisions as far as possible. We are not supposed to force him to believe in our decisions. We should give the hand and decision power as far as possible to the patient to choose what he wants to do. Being aware of his likes and dislikes, being honest with him. We are not supposed to lie to the patient. Taking time and energy to listen what he is saying. We should listen carefully. Avoiding sensitive subjects and issues. We are not supposed to talk about all those things which provoke him or which creates an anxiety in patients. Next, recognizing and reflecting on feelings which patients may express. When the patient talks, it is not the content is important to the note, but the feeling behind the conversation, which has to be recognized and reflected. Next is talking with a purpose. We should talk always with a purpose to patient. We are not supposed to communicate anything which comes to our mind. There has to be some purpose when we are talking to the patient. The nurse conversation with the patient must revolve around his needs, wants, and interest. Next, listening. The nurse should take time and energy to listen to what the patient is saying. She must be a sympathetic listener and show genuine interest. We should listen carefully. Permitting patient to express strongly held feelings. Strong emotions bottled up are potentially explosive and dangerous. It is better to permit the patient to express his strong feelings without disapproval or punishment. Feelings of anxiety, fear, hostility, hatred or anger should be expressed, tolerated, and allow him or her to express his feelings. When he expresses this negative feelings, maybe we can encourage him like verbal or in symbolic manner. And while he is expressing, make the patient comfortable. Next. So we have seen accept the patient exactly as he is. In that we have seen being non-judgmental and non-punitive, show interest in the patient as a person, then recognizing and reflecting on feeling which patients may express, talk with a purpose, listen to a patient, permit patient to express strongly held feelings. Next, use self-understanding as a therapeutic tool. A psychiatric nurse should have a realistic self-concept and should be able to recognize one's own feelings. Her ability to aware and to accept her own strengths and limitations should help her to see the strengths and limitations in other people. Self-understanding leads to understanding of others, right? Knowing how one thought or feel or act is not important, but to understand, like why one behaves the way she does is vital. Patient's behavior, can produce a lot of anxiety or fear in the nurse, and she thought to understand why she is anxious or why she is worried about all those things. So we should always understand and take those things as a therapeutic tool. Next, consistency is used to contribute to patient security. There should be a consistency in the attitude of staff, ward routine, and in defining the limitations placed on the patient. So consistency in our approach is needed to develop a feeling in patient that we can depend on the people working in the ward. Like our consistency must be reflected in our attitude, ward routine, defining the limitations placed on the patient. Like how we can demonstrate the consistency. So, next, reassurance should be given in a subtle and acceptable manner. To give reassurance, the nurse needs to understand and analyze the situation as to how it appears to the patient. Reassurance is building patient's confidence or restoring his confidence. Like to give reassurance, we need to understand the meaning of experience to the patient. We need to analyze the situation as to how it appears to the patient. And while giving reassurance, we must avoid saying to the patient statements like, you will get well, your fears are groundless, you are a nice person, nothing to worry, and making false promises. We are not supposed to make false promises. And how you can, reassurance can be given in the following manner. Like you can give them, like, be truly interested in the patient's problem, pay attention to the matter that are important to the patient, allow him to be as sick as he needs to be aware and accept how the patient really feels. So by doing all these things, you can demonstrate or you can show the reassurance to the patient. Next, patient behavior is changed through emotional experience and not by rational interpretation. So major focus in psychiatry is on feeling aspect and not on intellectual aspect. Advising or rationalizing with patient is not effective in changing behavior. We can do to change behavior, role play, socio drama, transactional analysis, a few ways. We can create emotional experience in a patient about his own behavior. Next, unnecessary increase in patient's anxiety should be avoided. So there are few approaches which may increase the anxiety in the patient. We should avoid that. Showing nurse own anxiety. We are not supposed to show our anxiety, that we are worried, we are anxious. Showing attention to the patient's deficit, making the patient to face repeated failures, placing demands on patients which he cannot meet, direct contradictions, on psychotic ideas. So anxiety is a feeling of fear for an unknown object or event. It is also a feeling of appreciation. It is also a threat to a biological integrity or self-system, which we call ego of a person. Right? So psychiatric patients already has some amount of anxiety owning their own illness, social disapproval, and seclusions from the family. Psychiatric nurse we are not supposed to further increase their anxiety. Next is objective observation of patient to understand his behavior. It is the ability to evaluate exactly what the patient wants to say and not mix up one's own feeling, opinion, or judgment. Next, maintaining realistic NPR. This focus the personal emotional needs of the patient and not on the patient's need. What is realistic or professional relationships? Like, it is focused upon the personal and emotional needs of the patient and not on nurse's needs, right? Such a relationship is therapeutically oriented and planned and is always based on patient's needs. Nurse, our goal is not shared by the patients, neither does we are supposed to ask the approval from the patient. Next, avoid physical and verbal force as much as possible. All methods of punishment must be avoided, like any kind of force applied on the patient that results in psychological trauma, that can be avoided. Like, for example, like a depressed patient welcomes the punishment or scolding as he is basically suffering from guilt of having done a mistake. So restraining the violent patient is in the court is an example of physical force. We are not supposed to restrain the patient. So any kind of physical or verbal force we should avoid, whether it is a physical or chemical or verbal. Nursing care is centered on the patient as a person and not on the control of symptoms. Analysis and study of the symptoms is necessary to reveal their meaning and their significance to the patient. Two patients showing the same symptoms may be experiencing two different needs. So every behavior is caused, like, understand the meaning behind the behavior, and the different individuals shows different symptoms for the same particular disease condition. Right? So we should understand patient symptoms. Like, for example, like one patient with headache, they may have different meaning of the symptoms to them, and one may have headache because of sleeplessness, right? So they may show the different symptoms. Next, all explanation of the procedure and other routines are given according to the patient's level of understanding. Every patient has a right to know what is being done and why it is being done to him. Every procedure should be explained at his level of understanding, depending on the limitation placed on him by his symptoms. Explaining to the patient reduce anxiety. When you are explaining the procedure or when you are explaining something related to his disorder or disease condition, that might reduce the anxiety of the patient, right? So the extent of explanation that given to the patient depends on his attention span level of anxiety and level of ability to decide. It should never withheld. And the character of explanation depends on the patient's span of attention, level of anxiety, level of ability to decide, etc. But the explanation should never be withheld. Why? Because sometimes we think that psychiatric patients are not having contact with reality or have no ability to understand. Next and last one, many procedures are modified but basic principles remain unaltered. In psychiatry, many procedures are modified but the underlying nursing principles remain the same. Yes. Like for example, giving enema or doing surgical dressing or catheterization and giving medication. The principles behind each remain the same. But the same procedure of each treatment may be different, right? For example, nursing principles, what we should keep in mind, like safety should be there, comfort, individuality, privacy, maintaining therapeutic effectiveness, verifying workmanship while doing the procedure, economy of time, energy, and material. So these are the things we should keep in mind while performing the procedure. And a patient who is highly suspicious of being poisoned may refuse to have oral tablets. At that time, ingestion of medication may be changed into parenteral methods, or some tablet may be powdered or dissolved in fruit juices and given. But the principles of nursing and scientific should remain same. So this was all about principles of psychiatric nursing. Today we have seen 12 principles. First one is accept the patient exactly as he is. Second one was use self-understanding as a therapeutic tool. Third one is use consistent behavior to increase patient's emotional security. Give reassurance to patient in subtle and acceptable manner. Change patient's behavior through emotional experience and not by rational interpretation. Avoid unnecessary increase in patient's anxiety. Demonstrate objective observation to understand and interpret the meaning of patient's behavior. Maintain realistic nurse-patient relationship. We should avoid physical and verbal force as much as possible, and providing nursing care to the patient as a person and not on control of symptoms of a disease that he or she is suffering from. Explain routine procedures at patient's level of understanding. And the last one we have seen is many procedures are modified but basic principles remain unaltered. So this is all about principles of psychiatric nursing. Thank you for listening.